Mike, until now, the orders have fallen under the province's public health emergency, but today these directives are flowing directly from the province's broader state of emergency. It means the government is getting stricter with its rules and outlining specific penalties for those who don't follow them.
The steps we're taking today are unprecedented. This is not a drill, it's a pandemic.
The harshest tone yet from the Premier as BC threatens consequences if restrictions are not obeyed under the province-wide state of emergency.
Dr. Henry's orders are not suggestions or good advice, they are the law. And as Minister of Public Safety, I will exercise my powers under the Emergency Program Act to ensure that those laws are enforced.
With that, he unleashed a swath of orders and specific mechanisms to enforce them. First, the creation of a provincial supply chain coordination unit to streamline distribution of goods. Also, an order for retailers to report key inventory, including items used by frontline workers. Also banning resale of food and critical medical supplies to end profiteering, and restricting purchases of essential products to prevent hoarding. There will also be a suspension of all local states of emergency, with the exception of Vancouver, and a direction for all municipalities to pinpoint properties to be used for the pandemic. Bylaw officers are also being redeployed with power to enforce compliance of the social distancing rules. Anyone in violation could be fined $25,000 or face jail time. Cities like Delta have already been doing these kinds of patrols.
We've had gates that we closed trails to that were just massive amounts of people, no social separation happening at all. They've been cut. Those are things that our bylaw officers are attending to. Posting, going to various takeout restaurants to make sure that they're following the proper separations.
Mayor George Harvey is supportive of the measures announced today, but others question whether they go far enough.
Is this really going to be effective in achieving 100% compliance with social distancing?
Dr. Gerald DeRosa is head of medicine at Royal Columbian Hospital. His signature is among hundreds in a letter from physicians to health officials. They've been appealing to the province for stricter measures, and he believes it's still not too late.
I fundamentally believe that we are still in the timeline where we could actually flatten the curve. I think the time is now. If we can do it now, I think we can cut down the cases and we can not end up in a situation like New York City.
So, Tanya, what has been the reaction from municipalities who've effectively lost their local states of emergency?
Well, many are okay with it, including the mayor of Delta we heard from there. He says he's fully supportive because it gets rid of the patchwork of responses across the province. But others in more isolated communities, up in Haida Gwaii, for example, we spoke with the mayor who says they have specific needs in those communities that they don't feel may not be specifically addressed under the broader province-wide state of emergency. And Mike, keep in mind, this is the first time in BC's history that these powers have been invoked under BC's Emergency Program Act. And they've also outlined a list of essential and non-essential businesses going forward. It's an exhaustive list, but you can find it on our website at cbc.ca/BC.
Unprecedented measures for sure. All right, Tanya, thanks very much. Tanya Fletcher reporting live tonight.